We have to find real solutions, and this is Bending the Trend. Hello, and welcome to our first episode of Bending the Trend. And we are thrilled to be joined by Scott Kirschner, who's the Senior Director of Global Benefits at Greystar and a longtime benefits consultant. Scott, welcome to the pod.
Thanks, John. Happy to be here.
So people ask, what's with the gloves? We are trying to fight rising healthcare costs. And, each individual conversation that we have, we believe is getting us closer to a more affordable healthcare market. So this new segment we're doing, Bending the Trend, we want to talk with benefits luminaries and leaders all over the country and understand what strategies they have used to bring down their healthcare spend. And so we can learn from each other. It's the goal of helping the whole industry learn best practices of how to drive down healthcare spend for yourselves as well as your employees. So Scott, welcome and excited to talk.
Terrific.
Yeah.
Let's get going.
So Scott, you've been at Greystar for a couple years now. You've had previous experiences leading benefits decisions at Iron Mountain, a couple other places, and then longtime benefits consultant. Over all these years, who are the best vendors that you've implemented that you would recommend to your peers in other benefits leaderships at other companies?
Yeah. I mean, today at Greystar, in the here and now, the two best that we've implemented since I've been here have been RULA and a significant expansion of our relationship with Lantern. And, I know you've talked to Dickon and
we're big fans of the COE model. Regardless which niche it's.
Yeah. And it's interesting because I think with the Lantern relationship I inherited was very challenging for them in that my predecessor had been here a long time. He was kind of forced kicking and screaming to implement Lantern and did not support them at all by my predecessor. And the CEO at Lantern and I have had dinner and talked about those challenges and how, he hit his head up against the wall to try and convince my predecessor, these are the things you need to do to make it successful. And when I joined, to take the boxing glove analogy, and I took their gloves off and said, we need to market more. We need to raise awareness. We're going to expand services. And since then, we've implemented their cancer care solution. We went live June 1st. Cancer and maternity are our two highest major diagnostic categories. And you think about cancer, and you have spoken to people about this. It's a very challenging diagnosis, and there's a lot of people involved. And I think when you are on your own to navigate that, you can take a lot of wrong directions, and there can be a lot of waste in treatment. And when you have that organization in your corner, back to the boxing analogy, you have a better outcome. You have a better experience. You feel more supported. Your family and friends who may be there with you also feel better supported. And ultimately, there's less waste and less costs to us as a plan sponsor of a self-insured medical plan and pharmacy benefit management.
And how many lives do you cover? Just so people.
So we cover just under 32,000 lives on our health plans. They're predominantly in self-insured plans. And, I would also say that part of the challenge too is people, they're trying to understand their treatment options on their own frequently. Oncologists only have so much time. Their staff only has so much time. And I think one of the challenges that we confront as benefits leaders and as your audience of digital health experts and consultants, and you get a diagnosis and you go Google it and you go down that rabbit hole. And it just, some of the stuff is insane.
Alarming and
alarming and very alarming, and people start to wonder. And so you want experts advising patients. And I like Lantern's model of a combination of oncology expertise, infusion therapy that can either be at home or in a brick and mortar infusion therapy center versus you're going to go to the hospital and it's going to be the most expensive location. And it's a horrible location to have that done. You're sitting there in the sterile environment. Have them come to your house. Go to a place that's comfortable. And then, the mental health support, the second opinion support that's baked in, those are all a good solutions. We are
In
further.
their core of surgery, correct?
Exactly. And then the COE surgical model where you can go, I'm in Boston, Dana Farber's here, go to MD Anderson in Houston. We have our biggest state is Texas for population. Go to Cedars-Sinai. They have all of the top cancer facilities in the US. Then with RULA, the challenge that we are trying to solve for is mental health is one area that we are above book of business in terms of utilization and expense. And I will note that overall, our per employee per month costs are low. So we are in a good place with that. And back to the bending the trend, our trend is higher than average. So we need to address that. Mental health is a challenge. 2 of our 4 self-insured plans are EPOs, so in-network only, and they cover just under 50% of the covered population. And, you connect the dots and say, access is very challenging. I've been doing this for 40 years, and I also came out of the health insurance world. I wish I had $100 for every time the head of a behavioral health unit within a health plan said, we're out there recruiting therapists, because I'd fund my son's college education. It's always a challenge, and there's a lot of reasons therapists don't go in network. RULA, the beauty of that is, it's available when it's convenient to the patient. All of the costs are submitted because they have a partnership with our plan administrator, United, and that they're all treated as claims and in-network claims. And, they can treat people as patients as young as 6. And one of the hardest areas to find therapists is adolescents. And I hear that frequently. And so they have a lot of bench strength in adolescent care.
And what age brackets do you consider adolescents, just so we get...
I would essentially say about 12 to 18.
So middle school and high school.
Middle school, high school, yeah. And I think that it is absolutely solving a need in that we have high rates of utilization. We have a lot of needs. We have an EAP, but the challenges of the EAP, that's very short-term crisis intervention. And what do you do if you need more medium-term to long-term care? And all of the feedback has been very positive so far. So SOD is a way to expand access in an area that demand is there, but the supply isn't meeting demand. So basic economics. So those 2 have been great. And then going back in my history, I have to note Livongo. When I was at Iron Mountain, one of the great things there was I had a blank slate. I had absolute support from senior management. We can't keep doing the same things. So all of these things I talked about for years about innovative solutions was like, let's try it. And I have long known diabetes was the most data intensive chronic condition, but most of that data was not accessible by primary care physicians and endocrinologists. So had been interested in how do we think about this as data collection and coaching in a different model. And this was when EOS Health was about 1.5 years old. They had 1 sales guy and like 25 people. And they kind of heard through the grapevine, hey, there's this guy in Boston at Iron Mountain. He may write you a check. And their first sales guy, who Randy Foreman, calls me. I'm like, this is exactly what we're looking for. As a benefits leader, it's like one of those also health plan moments. We had a long-term relationship with one of the BUCAs that a longtime account manager, and I said to her, we're pulling out diabetes disease management. And she flipped out and said, we'll do more. We'll make more phone calls. We'll send more letters. And I was like, you're killing me. No. So we're customer number 5. And we did a lot of the things that they learned how to do by pushing them. And when Glenn took over there, I really said, this is a model that we can expand. And as you probably know, like even more than half of people with type 2 diabetes are comorbid. So they have another condition. So let's think about how do we do this within the same ecosystem to expand? And so we said, let's do hypertension. And we'll be the beta test pilot for that solution. And like their first white paper was Iron Mountain. I was like their go-to reference. I was evangelical on what that opportunity was. That was a great solution. And then, I do continue to think about where the opportunities are. And, I think one of the things that I have been glad to be able to do also is take risks and say, we're going to fail sometimes. We've had a couple of epic failures. We haven't had any failures yet at Greystar, but we had a couple of epic ones at Iron Mountain.
Uh-huh. But still, overall, you moved forward and there was benefit.
Yeah. And I will say this. So I had good data. I started January 2013, and I had good data going back 9 years. Average annual trend during that 9-year period was 11.8%. And PEPM costs there were top of the market. Insane. Lots of chronic conditions. Over the next 6 years, our average trend reduced to 1.7%. And we had 2 years where we had negative trend. And here's the thing. We did not increase benefit cost sharing.
So proud of that.
It was all like getting people healthier. We also firmly embrace value-based care and high-performance neural networks. But it was that combination of really engaging people in their health and being top of book of business and utilization and marketing like crazy and engaging our people and rewarding them and had, really phenomenal success there.
So what did implementing both Lantern and RULA specifically do and accomplish for your enterprise as well as your individual employees?
Yeah, I think implementing Lantern is a recognition that cancer is a major condition within our population and that, here's a different way to approach it. We actually are relatively conservative financially. You think about those 32,000 covered lives. We have specific stop loss on a paid basis at $200,000. Like my second week here, I asked the consultant, is this right? We have such a low spec level and we pay a fortune for it. And so there's this focus on even those $100,000 to $200,000 claimants, they are disproportionately cancer patients. So how do we bend that curve a bit? So it really meant to the business, and to our people, and our culture is very people-centric. And, how do we provide them a better solution that maybe has fewer of those going to our specific deductible?
Mm-hmm.
I think the implementation for RULA too, be honest, went through a very difficult holiday period last year where we had 3 employees in a 2.5-week period commit suicide.
So sad.
And 2 of the 3 lived on site. So we do provide a housing discount if you are in our property management business, and recognize there are demands out there that aren't being met. So how do we think about a different model of delivering mental health care?
Mm-hmm.
And I knew some people at RULA, and I looked at Spring and Lyra and some of the others, and I sort of liked their model, and we could be more of a bigger fish in their smaller pond and get a little bit more attention. So, and they've been fantastic.
That's great.
Yeah.
Do we have any statistics on cost savings or increased engagement or less wait times to see a clinician?
We are getting our first reports from RULA very soon, so don't have those yet. Maybe when we chat again. But with Lantern, more on the COE side, we have seen almost a 400% increase in cost savings because it was pitiful how low the utilization was before I started, and really starting to raise awareness and direct people to that solution. So we've saved almost $3 million with Lantern through 2025 for the year.
Wow.
Yeah.
And that is mostly in surgery and cancer treatment.
That is almost all in surgery. Yeah. We've had the first cancer patients really start to go through, and and sometimes because those treatments can be longer, it takes longer to really calculate that final impact. You really kind of want them at a stage of, we feel like you're in a remission before you start to run the numbers.
Any other consequences or benefits from implementing both that are measurable?
I think there is a great deal of appreciation that we are trying to do something different and modernize things. And I've been before multiple groups, and I've been in front of our property management business leaders, and I've really talked these solutions up. And really this recognition, wow, this is great that at a corporate level, we're starting to roll these things out that really help our people in new ways And it's not just, I got to go to United for everything. And not that there's anything wrong with United. We have a great working relationship with them.
Yeah.
But, it is really to that point. I think of it as modernization.
Yep, absolutely. So we've already discussed what you've implemented that's done really, really well.
Mhm.
What are your biggest challenges that you would love to solve, but you haven't identified a vendor that can properly do that yet?
Yeah. You know, um, I really have been fascinated by the opportunities in navigation, and particularly digital navigation. It is. I think I was an early customer of one solution based on a lot of promise, and that was a bit of one of those epic failures. And I'm not going to say the name. But, you know, my I have this vision, this idea of somebody's going to figure out how to have real connectivity, real-time connectivity with electronic medical records, and start with like Epic, Cerner, Oracle, whatever you want to call it, and like the big wigs, and then move to like that next level. And that moment when you have a new diagnosis or a referral to a specialist or a new prescription drug, that you get notified. By the way, and especially like you think about cancer, because a lot of the outreach from Lantern, they have to wait for a claim to start. What happens if you capture that person within the first 24 hours when they hear that C word and are trying to understand what their options are, and they get a notification? Don't forget, Greystar has this service. It's no cost to you. If you agree to work with them, we actually waive deductibles and co-insurance, except in our high deductible health plan with an HSA, because you can't. But, the impact of that, the appreciation of that, the idea that someone is going to be better served. I'm fascinated by that potential, and I haven't seen anybody there yet.
Yep. Very, very exciting. Well, hopefully you inspire someone to create what you just described, because that would bring tremendous value
Yeah.
to the.
If I were younger and didn't have a family and things like that, I'd probably take a flyer and like go to Seven Wire Ventures and say, give me some money.
Like it.
I'd try it. Yeah.
I like it. Well, Scott, thank you so much for joining us on Bending the Trend. Really appreciate you being just incredibly transparent on what's worked really well for Greystar so that others can learn from your success. So thank you so much, and keep fighting the good fight against rising healthcare costs.
Always have, Norm. Thanks.
Thanks.
Pleasure being here.
Thanks for watching Bending the Trend, where we are looking to fight rising healthcare costs. We are asking benefits leaders what digital health solutions they've implemented that has helped them bend the trend.